40-month progression-free survival with the T-DXd and pertuzumab arm, where it was about 27 months with the THP arm.
What sort of endpoints you think are important, specifically in that space, when you're designing a trial?
Yeah. So, one important aspect that we've looked at in the DB09 trial is complete response rates. And so if you're talking specifically about can we get to that C word and advanced HER2-positive breast cancer, looking at CR rates and seeing if there are more patients that if we introduce this therapy in the first-line setting, could we get to that in more patients? Other things I think that are important are obviously durability of response. And then, toxicity, because like you said, for most patients, at least in 2025, we're not able to cure their disease. And so we really have to really focus on making the therapy as manageable as possible and really having meaningful quality of life.
Let's talk about DB09.
Yes.
DESTINY-Breast09. Can you give us a description of what that study is?
Yeah. So DB09 was a first-line trial that enrolled patients who had either de novo or recurrent metastatic HER2-positive breast cancer. It was roughly about 50-50 in terms of ER positive and ER negative, which is tends to be what we see. And these patients either received the Cleopatra regimen, taxane, trastuzumab, pertuzumab, or trastuzumab deruxtecan, or what we're going to call T-DXd plus pertuzumab, or T-DXd alone. So it was about 380 roughly per arm, and patients were randomized 1:1:1 to receive one of those treatment arms. And then we looked at, the key clinical endpoints of progression-free survival, overall survival. Obviously, we always think about CNS disease and, looking at that, clinical benefit and complete response rates and quality of life measures and safety. And so what we found at ASCO, we had the initial data that was presented. And so for the T-DXd monotherapy arm, that data will be presented with a few, the final analysis. But we heard the initial data from T-DXd and pertuzumab versus THP, and we found about 40-month progression-free survival with the T-DXd and pertuzumab arm, where it was about 27 months with the THP arm. And so that was a nearly 14-month difference in terms of progression-free survival. And I think many of us had expected that based off of, the second-line setting that used to be TDM1, and then DB03 moved that up into the second-line space. And so, the next kind of logical thing was, what about moving it up into the first-line setting?
And yes, so I personally wasn't surprised by the results, that it was going to be positive.
Yes.